My name is Dr. David Henderson. I'm the Chief of Psychiatry at Boston Medical Center, Professor and Chair of Psychiatry at Boston University School of Medicine. My research area over the years has been primarily in focusing on people with severe mental illness, and in particular, I study medical comorbidities such as obesity and diabetes and cardiovascular disease, and develop interventions to keep people with chronic mental illness alive. I'm originally from St. Louis, born in St. Louis. My family, we moved to Boston when I was 7, moved to Dorchester, and then eventually, when I was 11, we moved to Brockton. And so I basically grew up in the greater Boston area, went to college at Tufts University. After that, directly went to medical school at the University of Massachusetts in Worcester, and then did my medical internship at St. Elizabeth's Hospital in Boston, and then my psychiatry training at Massachusetts General Hospital. After I finished training, I stayed on at Mass General Hospital, as well as I took a position at MIT in the health services there, which was a fully run, medical services covering both students and faculty and staff. When I was at MIT, I had just finished the best training in the country, and when I started treating people, both from a therapy standpoint, from a medication standpoint, they weren't responding in the way that they had been, or in the way that my patients at Mass General would respond. And I really didn't understand it, but it turns out MIT is an international place, and I was treating people from all over the world, and the skills that I had received in training and the knowledge didn't really prepare me to take care of people from all over the world. And so that kind of began a new mission, which turned into part of my career, which is to try to understand how diverse populations, race, ethnicity, culture has an impact on health and mental health in particular. And so I've had 2 career paths now. One is with my work here in research in Boston, and then I have had this other focus, which has really turned me into kind of a global psychiatrist. In the course of my life and even career, race has been a major issue. Childhood, like I went from, living in Dorchester, predominantly, came from St. Louis, a predominantly black area, moved to Dorchester, predominantly black area, moved to Brockton at that time, predominantly white community. And so I spent, from age 11 to 14 fighting every day, simply because of, the color of my skin. I had to, fight every kid in school. So had that experience of just because of who I looked like, every day some kid had to challenge me and stuff. And so the medical school, too busy to even think about it, except for by the time you hit the wards and stuff in the 3rd year, the impact of race and ethnicities plays out, with opportunities and grades and so on, where you're performing well, your grade doesn't reflect that necessarily, that sort of stuff. The microaggressions that you would frequently encounter, both from the attendings, but the nurses and others and stuff, it was pretty regular. I remember sitting in a seminar, and one of the faculty members, with my group of 12 residents, one of the faculty members started talking about tar babies, and he went on, and I just got up and left. I really couldn't believe it, and I don't even think he knew what he was talking about. But it's pretty striking conversation to be teaching people and using that type of terminology and stuff, and so it was pretty striking. I remember as a faculty member, and I was, started getting invited to grand rounds around the country and stuff like that because of my research, and And just an example, so I get to a place, that night, and the person from the university is supposed to come pick me up at the hotel in the lobby, and they were supposed to be there at 9, and it's 9:05, 9:10, and my assistant is calling me saying, "Where are you? They're looking for you. They said you're not at the hotel." I said, "I'm sitting like in the lobby, like there's people walking by and stuff, but I've been sitting here for like 15 minutes. I don't know what else to tell you. I'm here." And she's like, "Let me say." And so the person walked by me 10 times, not once considered that the professor from Harvard was black. Walked by me 10 times. And it's like, it's pretty amazing. I mean, you can have these type of experiences all the time, and you can see how narrow people's thinking can be. Boston Medical Center and Boston University School of Medicine are world-class organizations that serve an extremely diverse and complicated population. I think, getting educated here or receiving training here, people will walk away with skills that they will not get at most other institutions, both in the complexity of the diversity, both in complexity of social aspects of health, and we could talk about social determinants of health and all that stuff, but we've got poverty, and we've got lower education status, we've got violence, we've got all of these things that impact on health, and so and substance use in particular. Like people who train here, no matter what discipline, will walk away with an understanding of substance abuse and how to help. So it's a very unique environment that way. And I do think that there's probably few institutions in the country, academic institutions in the country, that does offer this type of diversity, and we need to improve on that. I think that if you look at the medical students, the residents, and the people we train, they're very diverse, and I'm quite proud of that. The black male issue, it's very complicated. I think that you first have to, if you want to start recruiting black males, you start young. There's such a diversity in individuals' experiences and life experiences, economic experiences, and so on. It's across the board. Yeah, I think that people lumps everything together, and that everybody's got the same sort of problem. So when you kind of take that and you put racism or oppression on top of that, as Chet Pierce pointed out, this has medical and psychiatric consequences. So if you're experiencing microaggressions all the time, it takes a toll on you. And so, blood pressure's up, your body has inflammation, maybe your, insulin is, all of these, clearly things that we can measure, but it also takes a psychological toll on you. And then you start throwing in other things like, can that chip away at your confidence? Sure. Can it chip away at your self-esteem? Sure. Can it chip away at your opportunities? Sure, absolutely. And so, like unaddressed and going filtered, yeah, these folks are getting knocked off all over the place. And so that's why I said you start young, start with people young, you mentor them, move them through this, help them through when they're experiencing all of these negative experiences, and keep them moving forward. And I've seen poverty, born into poverty. I saw my parents sacrifice to get me out, and they focused on education. as the way out. We moved to Boston, better schools, and I think that played an important role right there. Along the way, I was able to find mentors, and I think in junior high, high school, my music teachers, college, my physics teacher, med school, not as much, but when I did my training and Chet Peer, I had two or three mentors. So I was able to find mentors that believed in me, but also exposed me to new things and gave me opportunities. Like I knew when I was 11 or 12, I wanted to be a doctor. That part got that worked out. But never knew I wanted to be a psychiatrist though, but I never, my vision of that was taking care of patients only, but I got exposed to research and teaching, academics and all of that stuff that I never saw myself doing, but I was given those opportunities. And that's really what we need to do, is to expose young people to those type of opportunities. It is possible. I went from a place where I was going to see patients and help patients, and that's what my passion was, to thinking, okay, wow, I can help whole populations. I can do work, I can do research that literally not just helps my patient, but can help whole populations. It's like, wow, that's pretty cool.